Avanafil, complete drug information. 1. Generic name, drug class, drug forms, brand name, generic name Avanafil. Drug class, phosphodiesterase type 5, PDE5 inhibitor, dosage forms, oral tablets, 50 milligrams, 100 milligrams, 200 milligrams. Brand names Stendra, United States, Spedra, Europe and other countries. Definition. Avanafil is a prescription medication primarily used to treat erectile dysfunction, ED, a condition in which a man has difficulty achieving or maintaining an erection sufficient for sexual intercourse. It belongs to a class of drugs known as PDE5 inhibitors and acts quickly to enable erectile function, often within 15 to 30 minutes of intake. 3. Mechanism of action. Avanafil works by selectively inhibiting the enzyme phosphodiesterase type 5, PDE5, in the corpus cavernosum of the penis. Here's how it functions in steps. 1. Sexual stimulation causes nitric oxide, NO, release in the penile tissue. 2. NO stimulates guanylate cyclase, increasing levels of cyclic guanosine monophosphate, CGMP. 3. CGMP causes smooth muscle relaxation, leading to vasodilation and increased blood flow. 4. PDE5 enzyme breaks down CGMP, ending the erection. Avanafil blocks PDE5, prolonging CGMP activity and maintaining the erection during sexual activity. Note: sexual stimulation is still required for Avanafil to be effective. 4 indications. Avanafil is indicated for erectile dysfunction, to help adult men attain and maintain an erection sufficient for sexual activity. 5. Contraindications. Avanafil is contraindicated in patients with use of any form of nitrates, e.g. nitroglycerin, isosorbide dinitrate, may cause life-threatening hypotension, known hypersensitivity to Avanafil or any component of the formulation, severe hepatic impairment, unstable angina, or other serious cardiovascular disorders, recent stroke or myocardial infarction within last 6 months, retinitis pigmentosa, a degenerative eye disease, concurrent use of guanylate cyclase stimulators, e.g. riociguat. 6. Before taking this medicine, precautions. Inform your doctor if you have cardiovascular diseases, e.g. heart failure, coronary artery disease, uncontrolled high or low blood pressure, kidney or liver dysfunction, bleeding disorders, stomach ulcers, anatomical penile deformities, e.g. Peyronie's disease, history of priapism, painful, prolonged erection, vision or hearing disorders. If you're taking medications for HIV, fungal infections, antibiotics, or prostate problems. Lifestyle precautions. Avoid alcohol. It can enhance hypotensive effects. Avoid grapefruit juice. It may interfere with metabolism via CYP3A4. Do not combine with other ED medications or recreational drugs like poppers, amyl nitrate. 7. How to use. Take orally with or without food, but preferably on an empty stomach for faster effect. Timing. Usually taken 15 to 30 minutes before sexual activity. Frequency. Do not take more than once per 24 hours. Sexual stimulation is necessary for the drug to work. Do not crush or split the tablets. Dosing information. Population, recommended starting dose, administration time, max frequency, elderly or liver impairment, general adult males, 100 milligrams 15 to 30 minutes before sex, once per 24 hours. Dose range 50 milligrams to 200 milligrams, elderly or renal liver impairment. Start with 50 milligrams. Use with caution. Dose adjustment. Increase to 200 milligrams if the 100 milligrams dose is not effective and well tolerated. Decrease to 50 milligrams if side effects occur. Now, I miss a dose, overdose. Miss dose, not applicable as it is taken as needed, not on a fixed schedule. Overdose, seek immediate medical attention. Symptoms may include severe dizziness, fainting, prolonged erection 4 hours, vision disturbances, chest pain. Nash 10, stop or avoid taking. Stop taking Avanafil and contact your doctor immediately if you develop chest pain during sex. You have an erection lasting longer than 4 hours, priapism. You experience sudden vision or hearing loss. You develop signs of an allergic reaction, e.g. rash, hives, swelling of lips, face. Avoid taking Avanafil if you're taking nitrates or other PDE5 inhibitors. You're advised against sexual activity for cardiac reasons. 11. Side effects in detail. Common side effects: mild to moderate, headache, flushing, warmth or redness of the face, nasal congestion, back pain, sore throat, dizziness. Less common side effects: indigestion, nausea, sleepiness, vision changes, blurred vision, color tint. Serious side effects: priapism, painful prolonged erection 4 hours, sudden vision loss, non-arteritic anterior ischemic optic neuropathy 9, sudden hearing loss, severe hypotension, chest pain or irregular heartbeat, allergic reactions, rash, swelling, breathing difficulty. Seek emergency help if any serious side effects occur. Chat 12. Vital information. Avanafil does not protect against sexually transmitted infections, STIs, including HIV. It is not approved for use in women or children. Should be stored at room temperature, 20 to 25 degrees to 68 to 77 degrees Fahrenheit, away from moisture and heat. Always take under medical supervision. Avoid driving or operating machinery if you experience dizziness or blurred vision. Other drugs that will affect Avanafil. Medications that interact with Avanafil: nitrates, absolute contraindication, nitroglycerin, isosorbide dinitrate, mononitrate. Alpha blockers, risk of low blood pressure, tamsulosin, doxazosin, YP3A4 inhibitors, increase Avanafil levels. Strong inhibitors, avoid use: ketoconazole, itraconazole, ritonavir, indinavir, HIV drugs, clarithromycin. Moderate inhibitors, use lower dose, erythromycin, fluconazole. Antihypertensives and diuretics may enhance hypotensive effects. Other PDE5 inhibitors, avoid concurrent use: sildenafil, Viagra, tadalafil, Cialis, vardenafil. Thank you. Have a nice day.